Hello everyone, this is Dr. Priyanka Sachdev and I welcome you all for second Prof Final Gear, this 75-hour rapid revision course. It's a rapid revision course to ace your university exams. Before starting, I would like to address few FAQs which I've frequently received on chats.
I haven't read anything. I did terribly in my pre university exams. Can FG save me?
FG is exactly for you. It is for the student who are starting late, starting scared, or starting after a bad pre-university result. But a bad pre-university result couldn't predict your university result. What predict is what you are actually doing between PUs and Us. FG is a system, and the system works regardless of the starting point. Distinction is the target, and we go for it together.
I've already read the entire Robbins. What will FG add for me?
Everything, because knowing is not equal to scoring. Reading Robbins and revising Robbins are two completely different things. You have knowledge, but you need a system that organize it, integrate it, and convert into exam ready output.
What is integration?
It is a technique to organize similar systems across patho, micro, and pharma. So we have three subjects, that is patho, micro, pharma, and we have 9 major systems in human body. You are knowing that. So I don't teach you subject wise. I teach you system wise. We take system one by one and we cover that system from all three subjects one by one. For example, day 7 is our CVS day. So on that day, you have to complete watching CVS diseases and pathology, CVS infections in microbiology, and CVS drugs and pharmacology. So it is for better retention, better understanding.
Your course is fast paced. How will I keep up in so little time?
The workbooks. That's the answer. It is not a textbook. It is not a printout. It is a strategic companion designed by me. On every page, you can see 80% is filled and 20% is intentionally blank. The blanks you have to fill during the session in real time so that revision goes on simultaneously. So by the end of all session, it will be no more workbook. It is converted into revision copy. The only revision copy you have to revise before your university exam. And the biggest catch is that the videos and the workbooks are 100% synchronized. Slide to slide, page to page. Whatever I'm teaching you in the videos, word to word, it is matching with the workbook. And we have done page stamping on the videos for easy navigation into the workbook. But if some students feels that they want 100% filled notes, they do not want to fill the workbooks. So the Prof Buster hard copy books for pathology and microbiology, they are already available on our website. You can go with that. It's 100% filled version of the workbook. It's already available. And along with the microbiology, master charts are also available. Master chart is a calendar. You can hang it on your wall, you can flip it, and you can compress the entire microbiology in just 50 pages.
I always start strong and then fall off schedule. What's different this time?
This time, you don't rely on willpower alone. You make public commitment. I dare you to take 16-day FG challenge. It's not just a timetable, it's a social contract. So, there are total 49 chapters in Patho, Micro, and Pharma. I have completed the 49 chapters in 75-hour lectures. You cannot watch 75-hour lectures in one go. That's why I divided the 75-hour lectures in 16 days. I have already decided that what you have to watch on what day. From day 1 to day 16, the complete schedule is in your hand. You can see one system, one day. For example, on day 9, it's respiratory system. So you have to finish watching respiratory disorders in pathology, respiratory microorganisms in microbiology, and the respiratory drugs and pharmacology. Likewise, one system, one day, the 16-day go, the complete syllabus, the 49 chapters in just 75 hours. So you already know what you have to watch today, what you have to read today, and that's the 16-day challenge. Every day, you finish your target. Every day, you tag me on Insta. Daily, no hiding. When the entire FG community is watching, showing up feels different. So, make a commitment, show up, tag me. Let's go. The 16-day challenge.
I understood what FG is. But, ma'am, can you please tell the exact steps to be followed?
There are 7 steps to be repeated 16 times for 16 days in a loop. Step number 1. Plan the next day the night before. It will take just 60 seconds but save your 60 minutes in the morning. Step number 2. Declare it publicly. Make a social contract. Make a public commitment. Step number 3. Start your day with coffee, tea, stay hydrated, and start watching the videos dedicated for that particular day in that folder with a timer. Don't forget to put the timer. Step number 4, fill the workbook simultaneously. Simultaneously means simultaneously. It should not be later, it should not be tonight, it should be simultaneously. Step number 5, after watching the video and filling the workbook simultaneously, there are two type of quiz we have attached with every video: the university exam quiz and the MCQ quiz. You have to solve both the quiz immediately after watching the video and filling the workbook to analyze yourself. Step number 6, track your progress either on the physical tracker, we are sending this to you, or the digital tracker which is already there on the app. You have to make a tick mark to analyze yourself and track your progress. Step number 7, analyze, reset, repeat for 16 days. If you are following these 7 steps for 16 days, take my word, the distinction is yours.
I am having my exams after 6 months. Is FG for me?
No, not useful now. You can enroll for Prof Buster comprehensive batch. You have time, you understand the concepts in detail. FG might be useful just before the exams.
I am an intern preparing for NEET PG. Is FG good for me?
No, FG is exclusively for second Prof university exams. Concept for both the exams might be same, but approach differs.
Is FG enough for university exam?
Yes, so 100% coverage of all LAQs and SAQs of all universities, pan-India. So 100% strike rate in just 75 hours. So, are you ready? Today, we are at day 1 of 16-day second Prof FG challenge. What's your today's target? Today, you have to complete a portion of general pathology, general microbiology, and general pharmacology in integration with me. In pathology, you have to cover cell adaptation, cell injury, cell death, and inflammation. In microbiology, a portion of general microbiology, and in pharmacology, a portion of general pharmacology. Total duration of all these is 6 to 7 hours. You have to complete it today only. That is day 1 of the challenge. So today's session is pathology session. In this session, I'm going to discuss inflammation. Likewise, we are going to continue for the upcoming 16 days in 16-day challenge. So let's start inflammation in pathology. In inflammation, I would like to teach you 4 topics here: general inflammation, acute inflammation, chronic inflammation, and chemical mediators of inflammation. From these, on these 2 topics, you can get long question in your exam. The remaining 2 can come for short question or very short question. Let's start one by one. Let's start with inflammation. First, you tell me what is inflammation. You define inflammation. Tell me the definition of inflammation and tell me the classification of inflammation. That is the general inflammation. Tell me the definition of inflammation. What is inflammation? Now, most of the students get confused between inflammation and infection. Let me tell you the difference between inflammation and inflammation by taking a very interesting example. I always say the infection is like a terrorist. Let's talk infection. Infection is caused by microorganism. There are 4 types of microorganisms which can enter in human body and cause the harmful effect, like the bacteria, the virus, the parasite, and the fungus. Why I'm calling them terrorist? Why? Who is a terrorist? Terrorist is a foreign particle who enter in the country and after entering in the country harms the country people. That's why we call it a terrorist. So similarly, the bacteria, virus, fungus, parasite, these are the microorganisms. They are foreign. They enter the human body, and human body is like the country people, and they harm the various cells of the human body and cause infection in the human body. And that's why I call these microorganisms as terrorist. I call it a terrorist. And I call the defense mechanism of the body, that is WBC of the human body, which is given by the God, as the army. What does the army do when the terrorists enter the country? Whenever terrorists enter any country, the army get activated and fight with the terrorist and prevent the country people from the terrorist. Similarly, the great God has given WBC in our body as a defense mechanism. As soon as any terrorist enters in human body, the guards, the army, the soldiers in the army, they are ready to do the defense and they cause inflammation. My topic today is inflammation. So what is inflammation? You tell me. Inflammation is a defense mechanism provided by the army, the soldiers of the army, that is WBC, in order to prevent the harmful effect caused by the terrorist, that is the microorganism. I hope everyone got the meaning of the inflammation. So I hope you all got the difference between infection and inflammation. Okay, what the terrorist is doing on the body is infection. What the defense mechanism of the body doing on the terrorist is inflammation. So inflammation is a defense mechanism to prevent or restrict the harmful effect caused by the terrorist. So that is the definition you can see here. So what is inflammation? It is body's defense reaction It is the body's defense reaction which is provided by WBCs. WBCs are the soldiers provided by the great God. So it is the body's defense mechanism in order to eliminate or restrict the spread of the injurious agent. The injurious agent is a microorganism, I mean the terrorist. It can be bacteria, it can be virus, it can be fungus, or it can be parasite. So this is the definition of inflammation. So in short, my topic today is inflammation. Inflammation is the body's defense mechanism. It is the body's defense mechanism provided by the soldiers, the WBCs of the body, the leukocytes of the body, in order to prevent the harmful effect caused by the terrorist, that is the injurious agent or the microorganism. Now, how many type of inflammation is there? There is two type of inflammation: acute inflammation and chronic inflammation. How we differentiate the two? We differentiate the two based on the onset and duration. Now, first you tell me what is onset and what is duration. Onset is the duration as soon as the terrorist enters the body and the first symptom. The duration between as soon as a bacteria enters in me, virus enters in me, parasite or fungus enters in me, the point of the entry till the first symptom, that is the onset. And what is the duration? Till how long I am ill. Let's take example, the best example. We all have tonsillitis in our life once or more than once. I guess everyone have experienced tonsillitis. So tonsillitis is an example of acute inflammation. And I don't think we have TB, or some of you maybe have. So TB is an example of chronic inflammation. TB in the lungs, pulmonary TB is an example of chronic inflammation. Let's take the example. This is also caused by a bacteria. This is also caused by a bacteria. The name of the bacteria most commonly here is Streptococcus pyogenes. And the bacteria here is Mycobacterium tuberculosis. The point this bacteria enters and the first symptom occur is the onset. The point the bacteria enters and the first symptom occur in TB, that is the onset. Here, onset is rapid. As soon as the bacteria enters, we have symptoms within next 2-3 days or within few hours only. But here the TB bacteria enters and it remains latent. It causes symptoms many months after its entry. So here the onset is after months. Here the onset is after hours or days. So onset is fast, onset is late. Second is duration. We all have acute tonsillitis, yes or no? Many times in our life, I have many times. So whether we take treatment or we don't take treatment, it lasts for a week or two. So maximum duration is a week or two, so it is short duration. But TB, even on taking treatment, lasts for 6 months. The treatment lasts for 6 months, so it is of longer duration. So acute inflammation, rapid onset, short duration. Chronic inflammation, late onset, long duration. You can take the example. Whenever acute, think about tonsillitis. Whenever chronic, think about the TB. You will get your answer for the onset and the duration. So onset, duration. The third is the hallmark feature. Whenever there is acute inflammation anywhere in the body from head to toe, edema always occur. Edema is the hallmark feature of acute inflammation. And whenever chronic inflammation occur anywhere in the body, granuloma formation is the hallmark feature. Granuloma formation always occur. Here the main cell, the hero cell, the main cell is neutrophil, which is responsible for acute inflammation. And here the main cell, the hero cell, which is responsible for chronic inflammation, is macrophage and the lymphocyte. So learn the differences between acute and chronic based on the onset, based on duration, based on hallmark feature and the cell. So say the differences between acute and chronic: acute inflammation, chronic inflammation. Tell me the onset. Tell me the differences based on the onset, duration, cell, and the hallmark feature. Here onset is rapid and duration is less. Here onset is late and duration is prolonged. Duration is long. Here main cells are neutrophil. Here macrophages or lymphocyte. Here hallmark feature is edema and here hallmark feature is granuloma. So these are the two types of inflammation. So you all know the definition and classification of inflammation. Now there are two types of inflammation, as I told you, acute and chronic. We will talk about them one by one because both of them are usually asked as a long question in your exam very frequently, ultra high important. So let's start with acute inflammation. If acute inflammation is coming in your exam as a long question, so you have to write down only two things. You have to write down the cardinal signs and 11 steps of acute inflammation. So let's start with the cardinal signs. What are the cardinal signs of acute inflammation? Acute inflammation can occur anywhere in the body from head to toe. What are the cardinal signs? There are 5 cardinal signs which always occur with acute inflammation, irrespective of the organ in which it is occurring. Whether it's meningitis, tonsillitis, bronchitis, appendicitis, any acute inflammation, 5 signs always occur. So these are the 5 cardinal signs which are associated with acute inflammation. Let's take the same example, tonsillitis, because we all have experienced it. Yes. So tonsillitis is the best example I can quote for the acute inflammation. Tell me, whenever we have tonsillitis, what happens to the tonsil? See, ma'am, the tonsil become red in color. Yes or no? So redness. Number two, tonsil temperature is more as compared to surrounding tissue. So that is increased local temperature. The tonsils swell. The tonsils swelling. There is pain in the tonsil. Fourth is pain. And there is temporary loss of function of that organ. Temporary loss of function of that organ. Now, these are the 5 cardinal signs. Whenever acute inflammation occurs any organ of the body, these 5 things happen. That organ turns red. The temperature of that organ is more than the surrounding tissue. That organ swell. There is pain in that organ and there is temporary loss of function of that organ. But the point is that this is an English language. We have to say cardinal sign in Latin, not in English. Do you know Latin? By the way, I don't know Latin. I don't know Latin. I know multiple languages, but not Latin. Okay, so we have to learn these signs in Latin language. Redness in Latin is known as rubor. Okay, increased temperature in Latin is known as calor. You know, calorimeter, calor. So rubor, calor. Swelling is known as tumor. Okay, tumor. Don't confuse with the tumor. Tumor is neoplasia, carcinoma. No, it is in English. In Latin, tumor means swelling. Pain is dolor. Pain is dolor. And loss of function is functiolesia. So you have to learn the 5 signs in Latin. Rubor, calor, tumor, dolor, and functiolesia. Rubor, calor, tumor, dolor, and functiolesia. Okay, these are the 5 cardinal signs you can see. The first 4 are given by Celsius and the last one is given by Virchow. So rubor, calor, tumor, dolor, functiolesia, the 5 cardinal signs. Now coming on the steps of the acute inflammation. How many steps are there in acute inflammation? I told you there are total 11 steps. Out of the 11 steps, 5 of them are vascular steps and 6 of them are cellular steps. So 5 plus 6, total 11 steps should be at the tip of your tongue for the long question. The 11 steps of acute inflammation. To understand these 11 steps, you have to understand a master diagram. I will teach you all 11 steps in one diagram along with the animations and videos. Okay, wonderful explanation. You can see, first you have to understand the master diagram. You can see these are the 5 vascular steps and you can see these are the 6 cellular steps. Don't mug it up. Don't mug it up. We will take them one by one. This is the master diagram in which I will teach you all 11 steps. So if you understand this, you will understand the session ahead. If you don't understand this master diagram, you are not going to understand it right. Now understand this master diagram. You can see this yellow color. Can you appreciate this yellow color? Yellow color is the skin. You can see this yellow. This is skin. Suppose this is a skin over here. It can be any area of the body. This is the skin. Okay, just below the skin, this is the blood vessel. Appreciate the blood vessel and appreciate the endothelial lining of the blood vessel. This is the blood vessel. You all can appreciate here. And this is the endothelial lining of the blood vessel. You can appreciate here. Endothelial lining you can see. Okay, everywhere below the skin we have blood vessels. So it can be any area of the body below which we have the blood vessel. Now there is a microorganism which entered inside. You can appreciate the microorganism I have shown with purple color. You can appreciate this is a microorganism. I will call it a terrorist. It can be bacteria, it can be virus, it can be fungus, it can be parasite, but it's a terrorist because it's a foreign particle and causing harm to the country people. So it's a terrorist. And inside the blood vessel, appreciate the green cells. Can you appreciate the green cells? This is the army, the WBC. This is our WBC. Although the blood have RBC and platelet also, but I have drawn only WBC because currently I am interested only in WBC. So this is the WBC you can see. And this is the army. See, ma'am, what is the problem? There is a terrorist, there is army, let them fight. You can see here I have drawn. You can see this is our WBC. This is the army. And you can see this is the terrorist. Can you appreciate the terrorist over here? You can appreciate this is the microbe terrorist. You say, what's the problem, ma'am? Why you need 11 steps? There is a microbe. I mean, there is a terrorist and there is army. Let them fight now. If the terrorist is strong, infection will happen. If the army is strong, inflammation will happen. Let them fight. We will see who is winning, who is more strong, and that thing will happen. Infection or inflammation. You know what is infection or inflammation. But there is a problem. Say, ma'am, what is the problem? Ask the problem. What is the problem here? You can see the problem is in front of your eyes. The problem is that the terrorist is extravascular and the army is intravascular. You can see the terrorist is outside the blood vessel and the army is inside the blood vessel. How they will fight? For fighting, they have to meet. Once they will meet, then only they can fight. But one is extravascular, one is intravascular. So there are 2 choices to meet them. either take the terrorist inside the blood vessel. No, it's a bad idea. The person will have septicemia. No, we cannot take the microbe inside the blood vessel. No, 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 bad idea. So we cannot do so. So other way around, we will take the army outside the blood vessel. Yes, that looks a logical and a good idea. So we will take the army, I mean, we will take the WBC outside the blood vessel in the space between the skin and the blood vessel where they will fight with each other, and ultimately the WBC will kill the terrorist, I mean microbe, and the inflammation will be over. For this, we need 11 steps. I hope everyone got this master diagram, and now I will come on the 11 steps. Let's start with the vascular events. There are 5 vascular events. There are 6 cellular events. Let's start with the vascular events, the 5 vascular events in the same diagram. These 5 I will take one by one. The first event is transient vasoconstriction. Transient, it's momentarily transient vasoconstriction of the blood vessels. Transient vasoconstriction. You can see this is the same diagram. You can appreciate where is the terrorist. Here is the terrorist. Appreciate the terrorist. So you know the blood vessel just below the terrorist undergo vasoconstriction. Appreciate this portion of the blood vessel which is undergoing vasoconstriction. So the blood vessel just below the terrorist undergo vasoconstriction. It's focal vasoconstriction, not global, and it's only in that area. And it's transient in nature. It is only for few seconds or few minutes. Few seconds or few minutes. So that is transient vasoconstriction that will lead to blanching. Blanching means, you know, less blood. The area above here is pellar. Suppose here at this point, the microorganism have entered below my skin. So the blood vessel here undergo vasoconstriction. So this area look pellar than the surrounding area, and that is known as blanching. Okay, you can appreciate first vasoconstriction. Okay, now second is vasodilatation. Persistent vasodilatation. This was transient vasoconstriction. Now persistent vasodilatation. You can appreciate this diagram. The same portion, you know, this is terrorist. Appreciate the terrorist. I mean, appreciate the microorganism, appreciate the injurious agent, whatever you say. The blood vessel below that, initially this portion was vasoconstricted. Now the same portion undergo vasodilated. What do you mean by vasodilatation? This is persistent vasodilatation. Vasodilatation. Focal area of the blood vessel is vasodilated. So there is more blood. Since there is more blood, if you look from outside, this is the eye. If you look from outside, this area look red from the surrounding area. So this area will look red from the surrounding area. So that will cause redness. And if you touch this area, since it is having more blood, it will warm than the surrounding area. So redness and warmth, I mean rubor and calor, can be explained from this point. Out of the 5 cardinal signs, I can explain these 2 points. Suppose at this point, there is a microorganism which enter inside. So this portion of the blood vessel, this portion of my blood vessel undergo vasodilatation. So it is having more blood. So this area look red and this area is more warm than the surrounding area. So rubor and calor can be explained over here. That is the second step. So first step was vasoconstriction. Second is vasodilatation. First step was transient vasoconstriction. Second step is persistent vasodilatation. Transient vasoconstriction leads to blanching and persistent vasodilatation leads to rubor and calor. Now coming on the third step. Third step is increased hydrostatic pressure. What is increased hydrostatic pressure? To understand this, you have to understand Starling's law. You have studied Starling laws in physiology. There are 2 types of pressure which act on a capillary. Hydrostatic pressure is due to water, water, and it is outside. It is outside pressure. Look at the arrow, it is outside. And oncotic pressure is due to protein. This one is due to water and this one is due to protein. And this one is inward pressure. This one is outward pressure. This one is inward pressure. Look at the arrows. Normally, they both are equal and opposite and they balance each other. Normally, they are equal and opposite. They balance each other. I have shown here. Now, you tell me what was the second step? What was the second step? Initially, there was vasoconstriction. First step. The second step was vasodilatation, which is permanent and persistent. Now, vasodilatation means more blood. Now, you can see vasodilatation. Appreciate this portion. It is vasodilated. So, it is having more blood. More blood means more water. More water means which pressure will increase? Hydrostatic will increase or oncotic. Normally they are equal. But since there is more water in this portion, more water, not more protein, more water. So outward pressure, I mean hydrostatic pressure will be more. So that is step number 3, increased hydrostatic pressure. Because of vasodilatation, there is more blood, more water. So increase hydrostatic pressure, which is the outward pressure. So outward pressure is more than inward. Normally outward and inward are equal and opposite. Since there is more blood, more water, so outward is more than inward. Since outward is more, I mean hydrostatic pressure is more than oncotic pressure since there is more water. Since hydrostatic pressure is more than oncotic, the fluid leaks out and will gather over here, accumulate over here. The fluid, only fluid The water will leak out because outward is more than inward. So, it will accumulate over here, leads to edema. This portion will be edematous. There will be edema over here. It will lead to edema. Edema. Now, there are two type of edema, transudate and exudate. So, here the fluid contain only fluid. So, this edema is transudate edema. Transudate edema don't contain protein, don't contain cell. It contain only fluid. You can see the same over here. Can you appreciate the capillary? Can you appreciate the outward pressure is more than inward? And that's why the fluid is leaking out and getting accumulated over here. So, that is edema, the transudate edema. Edema. The transudate edema. So the third cardinal sign is explained in this step. So here, the first step was vasoconstriction. The second step was vasodilatation. The third step is increased hydrostatic pressure. First, you learn the three steps. The first step lead to blanching. The second step lead to rubor and calor. The third step lead to edema. That too, transudate edema. Transudate. Now coming on the fourth step. Can I come on the fourth step? The fourth step is the hallmark out of the 11 steps. Out of the 11 step, the most important step is this fourth one. Okay, what is that? Increased vascular permeability. You didn't ask him, ma'am, how WBC will come out. I'm doing this entire activity, the 11 steps to take the WBC out. WBC is my army. I want to take my soldiers out so that they can fight with the terrorists. Say, ma'am, how they will go out? They need space to go out. I mean to say, this is the endothelial lining. Endothelial lining is continuous. It is continuous. If the endothelial lining is continuous, how this WBC will go out? How this WBC? So we have to create the gaps from which the WBC can escape. And creating those gaps is increasing vascular permeability. So first you learn the meaning of vascular permeability. Vascular permeability means creating gaps in blood vessel lining. In the blood vessel lining. How we create the gaps? There are 5 mechanisms. I will let you know all 5 mechanisms. But first you understand this is the hallmark step. Because here we are creating the gaps from which the WBC will leak out. The WBC will leak out later on. Before WBC, the protein and cells will leak out. Before WBC, the protein will leak out. Can you see here? Can you see this diagram? This portion is vasodilated. Okay. The fluid already leaked out because of increased hydrostatic pressure. Now the protein is also leaking out. See the background dots. These blue dots. This is all protein. The protein also leaking out. In this diagram, you have to appreciate these gaps. Appreciate the gaps between the cell. Appreciate the gap, G-A-P, gap between the cell. You should be able to draw this diagram. Okay, you should be able to draw this diagram. So appreciate the gap. Appreciate the gap from which the WBC will go out later on. Before that, the protein is going out. So there was already edema. That was transudate. Now that edema convert into exudate. Initially, the edema contained only fluid. Now the edema contained fluid and protein both. So edema become exudate. The same. Now see the 3 diagram. See the first diagram. In the first diagram, appreciate the endothelial lining, which is continuous. Okay. In the second also, it is continuous. In the first, the endothelial lining is continuous. There is no gap. In the second also, it's continuous. But what's the difference between first and second? Here, outward pressure and inward pressure is same. Here, outward is more, inward is less. And that's why fluid is leaking out. Only fluid leaking out, leading to transudate edema. Okay, later on, appreciate the lining is not continuous. See this cell, see this cell, see this cell, see this cell. And there is a gap between the cells. From this gap, the protein also leak out. Now the edema in the background, along with fluid contain the protein also. So the same edema from transudate convert into exudate. So what is the summary? What I'm saying? I'm saying that increased hydrostatic pressure lead to transudate and increased vascular permeability leads to exudate. Both are the types of edema. There are 2 types of edema, transudate, exudate. Transudate edema is due to step number 3 and exudate edema is due to step number 4. I hope you are getting it. So these are the 5 vascular events. Again, we will revise. Come on, again, we will revise. What was step number 1? Transient vasoconstriction. What was step number 2? Persistent vasodilatation. What is step number 3? Increased hydrostatic pressure. What is step number 4? Increased vascular permeability. Okay. Because of vasoconstriction, there is blanching. Because of vasodilatation, there is rubor and calor. Because of increased hydrostatic pressure and increased vascular permeability, there is edema. But initially only fluid comes out. That's why it is transudate. Later on, along with the fluid, the gaps are there. From the gap, the protein also leak out. So transudate edema convert into exudate. So this is the thing this I told you till now. But you may have a question in your mind. Before coming on the 5th step, you may ask, ma'am, how the gaps are created. You told us there are 5 mechanisms via which the gaps are created. Yes, there are 5 mechanisms via which the gaps are created. So before coming on the 5th step, I would like to tell you the 5 mechanisms of increased vascular permeability. These are the 5 steps. These are the 5 steps via which we can create the gaps from which initially protein come out, later on WBC will come out. These are the 5 steps. These are the 5 mechanisms. One by one we will take it. The first is endothelial contraction. Can you see these are the endothelial cell? This is one endothelial cells. This is second. This is third. This is fourth. They are in continuation. They are in continuation. Now imagine this cell will contract. This cell also contract. This cell also contract. If they are contracting, so it will be like this. This contracted, this contracted, this contracted. So automatically the gaps will be created between them. Appreciate the gaps. Appreciate the gaps. So the first and the most important and the most common mechanism is endothelial contraction. Endothelial contraction. Appreciate this cell, this cell, this cell, they all contracted, and appreciate the gap between them. So gap is only at the junction of the two cells. If I take the cross section of this blood vessel and look from the side, it will look like that. Can you see this is the cross section of the same blood vessel? Appreciate this is one endothelial cell, this is another endothelial cell, and at the junction of the two, appreciate the gaps. Appreciate the gaps. At the junction of the two, you can appreciate the gaps. Got it? So this is formation of endothelial gaps. You can appreciate the gaps are at the junction. You can appreciate the gaps are at the junction. I will show you. You can see the gaps are at the junction. Appreciate the gaps. Initially, they were in continuation and now they are in junction, from which you can see the protein is leaking out. Okay, the second mechanism, if the endothelial gaps are not there, endothelial cells are not contracting. Now, how to create the gaps? We want to create the gap so that the WBC will go and fight. So, in that case, the terrorist is very strong. The terrorist is, damaging and causing necrosis of the endothelial cells of our body and creating the gaps, creating the tunnel, and asking the WBC, asking the army, come out, fight with me, I have created the gap. So who is creating the gap? The terrorist is creating the gap. The terrorist is the injurious agent. So the gaps is created by the injurious agent. How they create the gap? They cause necrosis of the endothelial lining. Necrosis can be at the junction, can be at non-junction. It is not necessary. It is always at junction like the previous one. Now take the cross section over here. You can see the gap can be at the junction, can be at the non-junction. And who is causing this gap? The injurious agent, the terrorist. Sometimes you can see here. You can see the terrorist is causing the gap over here. Okay. Now you can see here the terrorist. Appreciate the terrorist. The terrorist is causing the gap, creating the tunnels and asking the WBC, come out, fight with me. Come out, fight with me. Okay, now third. You can see the third. Sometimes the terrorist is not very virulent. It is not very strong. It is weak. It is subtle. Now, how to create the gap? Endothelial contraction is not taking place. Terrorist is also strong. In that case, the army create the gap. Our own WBC. Our own WBC cause necrosis of our own endothelial cell. Yes, it is for our benefit only. You may be thinking, ma'am, why our own cell is causing damage to our own cell? Yes, it is for our benefit only, so that the WBC can go out and fight with the terrorist. So in that case, the WBC is creating the gap. The army is creating the gap, not the terrorist. Who is creating the gap? The army is creating the gap. So it is known as leukocyte-mediated endothelial cell injury. Who is causing endothelial cell injury? Who is causing necrosis of the endothelium? It is the WBC. Leukocyte is causing the damage. If you take the cross section, you can see these are the WBC who are causing the gap, maybe at the junction, maybe at non-junction. You can appreciate this video. You can appreciate this animation, appreciate the WBC who are causing the gaps at the junction as well as non-junction. You can appreciate here also. You can appreciate these are the WBC. They are causing the gaps. Who is causing the gap in this scenario? The WBC is causing the gap. The army is causing the gap. This is the third mechanism. The fourth mechanism, nobody is causing the gap. Say, ma'am, nobody is causing the gap. How WBC will go outside in that case, ma'am? You are saying neither the endothelial is contracting. You are saying neither the terrorist is causing the gap, neither the army is causing the gap. Then how the WBC will go out? How the army will go out and fight? It is cell within cell. Okay, this WBC will enter inside the endothelial cell from this side and exit from the endothelial cell from this side. It is cell within cell. It is known as transcytosis via vacuoles. This WBC will enter in a vacuole from this side, travel in the endothelial cell and come out from that side. And there is no gap. So it is transcytosis. It is via vacuoles. You can appreciate here. Transcytosis. You can appreciate it here. This WBC, you can see this WBC will enter. It is entering and, exiting that side. The protein and the WBC entering this side and exiting that side. The fifth and the last mechanism, it is new blood vessel. New blood vessel formation is known as angiogenesis. What do you mean by angiogenesis? It is formation of new blood vessel. Whenever there is an inflammation, angiogenesis is a feature of that. New blood vessel always formed at the place wherever inflammation takes place. And the new blood vessels are already leaky. The new blood vessel. Now see the endothelial lining. Can you see the endothelial lining? In the endothelial lining, see the nucleus. In the nucleus, you can see here mitosis is taking place. Via mitosis, I want to show you it is a new blood vessel. It is a new blood vessel because mitosis is still going on. Since it is a new blood vessel, angiogenesis is taking place, it's already leaky. There is no need to create the gap, it's already leaky. So the new blood vessels are already leaky. You can see this is angiogenesis. Appreciate the mitosis over here. I hope you all are appreciating the mitosis. Here, you can see the new blood vessels. Appreciate the mitosis. It's a new blood vessel and it's already leaky, from which the WBC will go out later on. So these are the 5 mechanisms: endothelial contraction, injury caused by the terrorist, injury caused by the army, transcytosis, and leaky blood vessel. You can see the 5 mechanisms via which the gaps are created. So these are the 5 mechanisms via which we can increase the vascular permeability. These are the 5 mechanisms via which we can increase the vascular permeability of a blood vessel so that the WBC can come out later on in the cellular steps, the 6 cellular steps, and fight with the terrorist. So this is increased vascular permeability. What are the 5 mechanisms? Number 1, endothelial contraction. Number 2, direct injury by the injurious agent. Number 3, leukocyte-mediated injury. Number 4, transcytosis. And number 5, angiogenesis. Blood vessels are leaky. Leaky blood vessels. Leaky new blood vessels. You can appreciate the 5 mechanisms. These are the 5 mechanisms of increase vascular permeability, the hallmark step. The 5 mechanism of increased vascular permeability. So I was telling you the 5 vascular events. There are total 11 steps. Out of the 11 steps, the 5 are vascular and the 6 are cellular. Currently, we are studying the 5 vascular steps, the 5 vascular events of acute inflammation. We have already done the 4: vasoconstriction, vasodilatation, increased hydrostatic pressure, and increased vascular permeability. Vasoconstriction leads to blanching. Vasodilatation leads to rubor and calor. Increased hydrostatic pressure leads to edema. And increased vascular permeability also leads to edema. But this edema is transudate, this edema is exudate. And there are 5 mechanisms of increased vascular permeability. You know the 5. Now coming on the 5th and the last step. The 5th and the last step of vascular events is stasis. The fluid is already out and the protein is also out. Initially the fluid goes out because of increased hydrostatic pressure, and later on because of the increased vascular permeability, the gaps, the protein also goes out. So imagine from the blood, the fluid and the protein leaks out. So there is clustering of the cell. The cell get clustered and it is known as blood stasis. So blood stasis increases the viscosity of the blood. This is the 5th step. You can see here, first the fluid will go out, then the protein will go out. This is the microbe coming. First the fluid will go out, then the protein, and then finally there is stasis. Now, what are the 5 steps we have studied? I will show you one video in 5 steps of vascular events are done. Vascular events, we are done and dusted. What are the 5 steps? Tell me the 5. I'm teaching you acute inflammation, by the way, in which there are total 11 steps. There are 5 vascular, 6 cellular. What are the 5 vascular steps? Transient vasoconstriction, persistent vasodilatation, increase hydrostatic pressure, increase vascular permeability, and the last one is stasis. Stasis 1, 2, 3, 4, 5. And you should know the consequence of each step. We have revised many times. I hope you know it. The first step in vasoconstriction leads to blanching. Vasodilatation leads to rubor and calor. Hydrostatic and vascular permeability leads to edema. This is transudate, this is exudate. And stasis leads to increased viscosity. You want to see an animation, a wonderful animation of all 5 at one place? See here. I will show you. Just a second. You can appreciate here. So first of all, you can appreciate this is master diagram. Appreciate the microbe is coming. This is terrorist, the red color, entered. The first step is vasoconstriction. Transient vasoconstriction. Appreciate. The blood vessel just below the terrorist undergo vasoconstriction, which is leading to blanching. Step number 1. Now, step number 2 is vasodilatation. Persistent vasodilatation. Appreciate the same blood vessel undergo vasodilatation. Then increase hydrostatic pressure. You can appreciate the fluid leak out. the fluid leak out. Increase hydrostatic pressure, the fluid leak out, leading to transudate edema. Now the gaps will be formed. Appreciate the gaps are forming. Appreciate the gaps. People appreciate the gaps from which the protein leak out. So increase vascular permeability, the hallmark step, from which the protein also leaking out, leading to the edema, exaggerating the edema. Edema convert from transudate to exudate, and blood stasis. The fifth and the last step is blood stasis. You can appreciate the 5 steps in one video. I hope everyone got it. Is there an experiment to prove that? Yes, there is an experiment. The experiment is done by Lewis. It is known as Lewis triple response experiment. What is known as Lewis triple response experiment? What is Lewis triple response experiment? Lewis has taken a pen, okay, a blunt object pen, and on the forearm given a strokes. Look, I'm doing. Take a blunt object like a pen, okay, a blunt object, and give a stroke. Give a stroke on the forearm. If you can see, I'm giving a stroke on my forearm. What will happen? First, there will be a red line formation. After that, this is known as red line. You can see this is known as red line. Appreciate. Okay. After that, the area around the red line also undergo redness. It is known as flare. And after that, this complete area swells up. This is known as wheal. So first of all, this line become red. Then the area around it become red and the complete area swells up. It is known as red line, then flare, then wheal. Now, can you tell me which step out of the 5 vascular event, which step is occurring in which? Why there is a red line? You can appreciate this is red line. You can appreciate this is flare. Flare means the area around the red line also become red. And this is wheal. Wheal means the complete area become edematous by giving a stroke on the forearm. Give a stroke on the forearm. This is done by the Lewis. Now, first of all, red line is due to vasodilatation. First step is vasoconstriction, then vasodilatation. It is persistent vasodilatation of the capillaries. Then flare is again vasodilatation of the arterioles. And wheal is due to step number 3, increased hydrostatic pressure. So out of the 5 steps, this one and this one can be explained in the Lewis experiment. I hope you all got it. So what are the 5 steps? Can we revise 5 vascular steps? And after that, I will move on the 6 cellular steps quickly. What are the 5 vascular steps, people? Come on. What are the 5 vascular steps? First, transient vasoconstriction. Appreciate this area undergo vasoconstriction. Then persistent vasodilatation. Appreciate this area undergo vasodilatation. Vasodilatation. Increase hydrostatic pressure. Outward pressure is more than inward because of more blood, more water. So you can see the fluid leaks out and causing edema. Transudate edema. Then appreciate the gaps. Appreciate. See in this diagram there is no gap, but here there is gap. From the gap the protein also leak out. So the edema convert into exudate. There are 5 mechanisms of the gap. You know the 5 mechanism, and the 5th step is stasis. The fluid leak out, protein leak out. So the clustering of the cell is known as stasis. So this is the summary of the vascular event. In the vascular event, we have already created a gap. Whatever is the mechanism of the gap, there are 5 mechanisms of the gap. Whatever is the mechanism of the gap, I'm not interested, but ultimately a gap is created. Now in the 6 cellular events, I will take the WBC out of that gap. You see, ma'am, you need 6 steps to take the WBC. Yes, I need 6 steps to take the WBC out of this gap. It is not as easy. The gap is already there. In the vascular event, we have already created a gap. But in the cellular event, we will take the WBC out of this gap and make it fight with the terrorist. We will take the soldier out. I hope you are getting it. So we are done with the vascular event. You know the summary of the vascular event. You know the total 5 vascular events. Now let's come on the cellular events. There are 6 cellular events. Let's come on the cellular events. There are 6 cellular events. What are the 6 cellular events? There are 6 cellular events. Let's come on the cellular events. The 6 cellular events. One by one we will take. You can see I have shown all 6 cellular events in this diagram. So ma'am, what's the problem? You are saying the gap is already there. This is the gap. Why you are not taking the WBC directly off this gap? WBC cannot go directly out of this gap. Why? Because of Bernoulli's theorem. What do you mean by Bernoulli's theorem? Have you studied in physics the Bernoulli's theorem? Bernoulli's theorem says that in a pipe, if a fluid is flowing in a pipe, the lighter part is at the periphery and the heavier part at the center. You know, in blood we have RBC, WBC, platelet and the plasma. Most lightest is the plasma. So at the periphery we have plasma. At the periphery we have plasma. After that, we have platelet. After that, we have platelet. The second lightest is the platelet. After that, we have RBC. This is RBC. RBC. Okay. And WBC is the heaviest. WBC travels at the center. WBC is at the center. So this is known as axial blood flow. What it is known as? Axial blood flow, in which the WBC travels at the center. This blood flow is known as axial. It is normal in you, me, everyone. It's like that. Say, ma'am, then what's the problem? The problem is that the gap is at the periphery. This is the gap created by one of the 5 mechanisms. The gap is at the periphery. WBC is at the center, but the gap is at the periphery. How WBC will come out of the gap? It cannot come. So first you have to take the WBC from the center to the periphery before it comes out of the gap. So it needs few steps. There are 6 steps. So can you see this is WBC at the center? Say yes. The army at the center, the soldier at the center, say yes. First it is leaving the center and coming to the periphery. The step number 1 is margination. It is coming to the margin. That's why margination. So WBC leaves the center. This is WBC. It is leaving the center, coming at the periphery. It is known as margination. It is known as margination. After that, this is the gap. Okay, the gap is at some distance. The gap is at some distance. Okay, so WBC is rolling. WBC is rolling like the wheel, like the tire on a road. Have you seen a tire on a road? So WBC is rolling like a tire on the road. WBC is rolling like a tire on the road. This is known as rolling. Just before the gap is stopped, it is known as adhesion. It is the step number 3 is adhesion. Then it will come out from intravascular to extravascular. The army, the soldier is coming out. It is transmigration. It is transmigration step number 4. So first margination, then rolling, then adhesion, then transmigration. Now it's a 3-dimensional space. Here is the terrorist. Here is the terrorist. Okay. So WBC, how WBC will come to know where is the terrorist in a 3-dimensional space after coming out? This terrorist secretes some chemicals and attract the WBC towards it. WBC don't have eyes to see where is the terrorist. I should go this side, not this side. So the chemical will attract it, and towards the chemical it will move. It will move. It is known as chemotaxis. And finally, they are in front of each other. The terrorist and the army, they are in front of each other. And army will kill the terrorist. I mean phagocytosis. The last step is phagocytosis. So these are the 6 steps. First margination, then rolling, then adhesion, then transmigration, also known as diapidiasis, then chemotaxis, then phagocytosis. Okay, I hope everyone got it. You want to see a video, all 6 steps? I will show you in one video, all 6 steps, everyone on the screen. See one animation, all 6 cellular events. Appreciate the army. First, it is see again. First, from the center, it is coming to the periphery. This is margination. Now, this is rolling like the tire on a road. This is rolling. Then adhesion. Then transmigration. Then chemotaxis. And then phagocytosis. I hope everyone got the 6 steps. These are the 6 steps of cellular events. Let's start the details of these steps one by one. The first step is margination. As I told you, margination and pigmentation. You can see here. What is margination? I told you normal blood flow is axial, in which WBC, the heaviest, travel at the center, and RBC, platelet and plasma travel at the periphery. So this is axial blood flow. Now WBC leave the center and come at the periphery. This is known as reverse axial blood flow. So basically, what is the definition of margination? In margination, the axial blood flow convert to reverse axial blood flow, in which the WBC from the center come to the periphery. So axial blood flow convert to reverse axial blood flow. This is the first step, margination. After margination, you can see the gap is at a distance. It is not just right away. It is at a distance. So WBC have to travel this distance. How the WBC will travel this distance? It is via rolling. First, you see the margination. You can see the WBC leaving the center and coming at the periphery. See again. WBC leaving the center and coming at the periphery. This is known as margination. Now, after margination, this is rolling. How rolling occurs? I told you rolling you can compare like the tire on a road. Suppose this is tire, suppose this is road. So how the tire roll on the road, in the same way WBC roll on the endothelium. So here I am considering the WBC as a tire and I am considering the road as endothelium. So how does the WBC is rolling on the endothelium in the similar way like the tire rolls on the road? You can see in this diagram also. Can you see in this diagram where is the endothelium? You all can appreciate this is endothelium. Compare the endothelium with the road. This is endothelium and here is the gap. The WBC have to reach this gap. You can see this is the WBC. Here is the WBC. Can you appreciate? First WBC leaving the center and coming to the periphery. After coming to the periphery, it's rolling. It's rolling like the tire on the road. Appreciate it's rolling and reaching up to the gap. Just before the gap, it stops. So you can compare. This is the road. This is the WBC. This is endothelium like the road. This is WBC like the tire. It is rolling. And just before the gap, it stops. The stoppage is known as adhesion. But how does the rolling and the adhesion takes place? The rolling and adhesion takes place with the help of bonds formation. So there are molecules present on the WBC. The complementary molecules are present on the endothelium and transient bonds are formed between them. So bond form, little bit it moved, bond break. Then again bond form, then again it moves, bond break, then again bond form, then again it moves, then bond break. So it keeps on going because of the transient bond formation between the molecules present on the tire and the road. So the great God has given 5 pairs, the 5 pairs of complementary molecules. These are known as complementary adhesion proteins, complementary adhesion molecules, CAMs. So, whatever molecule is present, the corresponding molecule is present over here, and a transient bond is formed between them, and it keep on moving, and the bond keep on shifting. You can see the concept of complementary adhesion molecules. So transient bonds are formed between the tire, that is WBC, and the road, that is endothelial cell. So why I'm saying the word transient, because the bond form, bond break, bond form, bond break, and it keep on rolling. And this is the definition of rolling. So you can see this is rolling. And what is adhesion? Just before the gap, the bond become firmer and it don't move, it stop, and this is known as adhesion. So the difference between rolling and adhesion is the type of the bond. In rolling, the type of the bond is transient. In adhesion, the same bond become firmer, and that's why it will stop. You can see I have drawn the molecules. The corresponding molecules are present on WBC. You can see. So first margination, then rolling, and just before the gap, adhesion. So I hope you are getting it. These are the complementary adhesion molecules, CAMs, which I am talking about. You can see this very beautifully in this diagram. Can you see in this diagram the road? The road is the endothelium. Appreciate the road. And you can see the tire. The tire is the WBC. You can appreciate the tire. You can appreciate the road and the tire. Now I want all of you to see the 5 pairs: first pair, second pair, third pair, fourth pair, and fifth pair of complementary adhesion molecule. So whatever molecule present on the tire, the corresponding molecule present on the road, and they make a bond between them. So you can see a bond between this and this. You can see a bond between this and this likewise. So first pair, second pair, the pairs are unique. So you have to learn in this CAM, the 5 pairs of CAMs, the complementary adhesion molecules, the 5 pair of CAM, which molecule is present on the road, that is endothelium, and which molecule is present on tire, that is WBC. And you have to learn the pair by pair. You can appreciate the 5 pairs in front of you. So let me explain. Let me help you in learning. Appreciate the first pair. You can appreciate the road. Can you see the road? When I say road, look at the endothelium. So on the endothelium, there are 2 types of selectin, P-selectin, E-selectin. You can see P-selectin, E-selectin. Both of them form the bond with silyl-Lewis X present on the tire, that is WBC. So P-selectin form a bond with silyl-Lewis X. You can see this is P-selectin, this is silyl-Lewis X. Similarly, E-selectin also form a bond with silyl-Lewis X. So the first pair is P-selectin and silyl-Lewis X. The second pair is E-selectin and silyl-Lewis X. Okay, the third pair, there is third type of selectin, L-selectin for leukocyte selectin. L-selectin present on tire, not on the road. So P and E-selectin present on the road, but L-selectin present on the tire. L-selectin form a bond with glycan. With glycam. So glycam with L-selectin. And there is ICAM and VCAM. ICAM and VCAM form bond with integrin present on the WBC. ICAM form bond with beta-2 integrin, and VCAM form a bond with beta-1 integrin. So you have to learn these 5 pairs. 5 pairs. I will come on the 6th pair also, but first you have to learn this table. Learn this table. P-selectin, E-selectin. Both of them form bond with silyl-Lewis X. Okay. Then L-selectin form a bond with glycam. Glycam say ICAM and VCAM. ICAM and VCAM form bond with integrin, beta-2 integrin and beta-1 integrin. And the last and the 6th pair, there are actually 6 pairs. Okay, the 6th and the last pair is PCAM, PCAM. You can see PCAM bind with PCAM. The only molecule which is present on both, which is present on the road as well as tire, PCAM and PCAM. You can see this table. So you have to learn this table. You have to learn the 5 complementary adhesion molecule. The first and third pair is responsible only for rolling. The fourth and fifth pair is responsible only for adhesion. The second is responsible for rolling as well as adhesion. Rolling as in. The sixth pair is neither for rolling nor for adhesion. It is for transmigration, the next step. I hope you all are getting. Let me teach you transmigration, then I will draw this table for you. What is transmigration? This is the 4th step. I told you, first the WBC leave the center and come to the periphery, that is margination. After that, it is doing rolling. It is doing adhesion because of the 5 pairs of complementary adhesion molecule. Then WBC leave intravascular space and come extravascular space. So from intravascular to extravascular, this is transmigration. This is with the 6th pair. The 6th pair is PCAM, PCAM. So here also we have PCAM. And on the tire and on the road also we have PCAM. So PCAM bind with PCAM and that's why it moves out. So it is PCAM with PCAM. The PCAM also known as CD34. It is also known as CD34. PCAM bind with PCAM. And this is transmigration, also known as diapediasis. So can we draw this table? So there are 6 pairs. What are the 6 pairs? 1, 2, 3, 4, 5. 5 of them are responsible for rolling and adhesion, and the 6th one is responsible for diapediasis or transmigration. Now tell me what is present. What is present on the endothelium, that is rod, and what is present on WBC, that is trier, and tell me the function of each of them. So write down the 3 selectin. We are having P-selectin, we are having E-selectin, and we are having L-selectin. L-selectin is on leukocyte, that is WBC. So P-selectin, E-selectin, both of them form a bond with Lewis X. L-selectin form a bond with glycam. From glycam, you will remember ICAM and VCAM. ICAM and VCAM form bond with integrin. ICAM with beta 2 integrin, VCAM with beta 1 integrin. These are the 5 pairs. This is how I learn. And the 6th pair is PCAM with PCAM. That is CD34 with CD34. Okay, now tell me the function of each of them. This one, the 1st and 3rd, is responsible for rolling. The 4th and 5th is for adhesion if you're not changing the sequence. And the 2nd one is rolling and adhesion. And the last one is responsible for transmigration as well as diapediasis. So this is how you have to learn this table. Very important. The fifth step is chemotaxis. Once it is out, you can see the WBC is out. WBC don't have eyes. Where is the terrorist? I should go that side. So how in a 3-dimensional space after coming out, WBC moves only in that direction in which the terrorist is present. So terrorist secretes certain chemicals that attracts the WBC, and WBC moves towards the chemical. It is known as chemical gradient movement. The movement which is oriented via chemical gradient. It is chemotaxis. Chemotaxis is unidirectional chemical gradient movement. Chemotaxis. So name the chemical which is secreted by the terrorist, which is attracting the WBC. There are 4 chemical. One is leukotriene. 2 of them are complement. And 1 is interleukin. Learn the numbers. Leukotriene is B4. The 2 complement is C3A and C5A. The 2 complements, and interleukin is 8. So name the 4 chemicals secreted by the terrorist to attract the bacteria, to attract the WBC towards it. What are the 4 chemicals? 1 is leukotriene. The next 2 is complement, then interleukin. Say their numbers. The numbers are important. Leukotriene B4, complement C3A, C5A, and interleukin 8. Among them, the most powerful is C5A. It's your MCQ. C5A is most powerful. You can see this is WBC. You can see the WBC is moving towards the chemical. This is how it moves. So here, suppose there is a terrorist which is secreting the chemical and attracting the WBC towards it. The 6th and the last step is phagocytosis. What is phagocytosis? Now, the terrorist and the soldier are in front of each other, 1-to-1, They will fight, and the soldier will eat the terrorist. Eating of terrorist by the soldier is phagocytosis. Phagocytosis is eating of the bacteria via WBC. WBC is eating, engulfing the microbe. You can see this is WBC. Appreciate WBC. And here you can see the WBC is eating the terrorist. You can appreciate the WBC is eating the terrorist. This is known as phagocytosis. You can appreciate the blue one is the WBC. And you can see how it is eating. It is known as cell eating. Okay, you can see this is phagocytosis. What are the steps of phagocytosis? Sometimes you get short note on phagocytosis, the steps. There are 3 steps. First, the WBC come, recognize the bacteria and attach with the bacteria with the help of receptor. Then it will engulf the bacteria inside it. And after engulfing, it will kill the bacteria. Killing is via 3 steps. I will explain. You can see this complete cell is WBC. Can you see this cell? This cell is a WBC cell. Appreciate this cell is WBC. Okay, and you can see this is bacteria, the microbe, the terrorist. So first, the soldier is recognizing and attaching with the terrorist with the help of receptors. Appreciate the receptors on it. With the help of receptors, it is appreciating. So first, attachment and recognition. Then engulfment. It is engulfing inside. Once it is engulfed inside, making an envelope, now it will kill it via 3 steps. It will kill it. You can see this yellow cell. You can see in this video, this yellow cell is WBC. And this is bacteria. So first it is recognized and engulfed. I hope you got it. Once it is engulfed, now there are 3 steps. What are the 3 steps? First, this cell is WBC. Okay, this cell is WBC. Now, how it will kill the bacteria? The bacteria is already inside it. How it will kill? First, this WBC will take the oxygen and convert the oxygen into superoxide ion. Convert the oxygen to superoxide ion with the help of NADPH. Okay, NADPH oxidase. with the help of NADPH oxidase. So this is step number 1. After that, the superoxide ion convert into H2O2. Step number 2. So step number 1 and 2 is common. Step number 1, the oxygen get converted to superoxide ion with the help of NADPH oxidase. Step number 2, this superoxide ion will convert into H2O2. Step number 2. Now, step number 3 is of two type. Some WBC have MPO enzyme in that. Some WBC do not have MPO enzyme in that. So one is MPO dependent killing, one is MPO independent killing. If it is MPO dependent, this H2O2 will convert into it will convert into HOCl. It will convert into hypohalous acid, HOCl, and that will kill the bacteria. And it was converted via MPO. If there is no MPO, so this H2O2 convert into OH negative, hydroxyl ion. And this hydroxyl ion will kill the bacteria. If this conversion is done by iron, it is Fenton's reaction. If this reaction is done by superoxide ion or oxygen, it is known as Haber-Weiss reaction. I hope you got the 3 steps. So what are the 3 steps? This is WBC. This is WBC, the soldier. And inside this WBC, this is the bacteria which is present inside the envelope. I want to kill it. So how it is going to kill it? So first, this WBC recognize the bacteria. This is the bacteria. It is recognized. It is engulfed inside and packed in an envelope. Now we want to kill it. Recognition is done and engulfment is done. Now we want to kill it. So there are 3 steps. First, the first step. Oxygen get converted to superoxide ion. Then superoxide, step number 2, converted to hydrogen peroxide. These 2 steps are common. So first step, oxygen get converted to superoxide with the help of NADPH oxidase. And here superoxide converted to H2O2. This is step 2. Step 1 is common, step 2 is common. Now step 3, this H2O2 can convert in one of the 2 things. If MPO is present, okay, this MPO enzyme convert it into HOCl. And this HOCl kill the bacteria. If MPO is absent, okay, then MPO is myeloperoxidase enzyme. If it is absent, either in presence of iron or in presence of oxygen, it will convert into hydroxyl ion, and this hydroxyl ion is bactericidal. It will kill the bacteria. So who is killing the bacteria? Either HOCl is killing the bacteria or hydroxyl ion is killing the bacteria. The step number 3 depends on MPO presence or MPO absence. If it is MPO absent, it can be Fenton reaction or Haber-Weiss reaction. This is the simplest I can explain you. The 3 steps of phagocytosis. You can see all 3 steps over here. You can appreciate step 1. Oxygen converted to superoxide. Step 2, superoxide converted to H2O2. And step 3, H2O2 convert either into HOCl or into OH negative, depending MPO present or MPO absent. And this is how these 2 things are bactericidal and they are killing the bacteria. So we are done with the vascular events. People, I'm teaching you vascular events. I hope everyone got the 5 vascular events. There are total, I'm done with all 11 events. I taught you the 5 vascular events and 6 cellular events, total 11 events. Can we revise the 11 events quickly? What are the 5 vascular events? Can we revise the 5 vascular events? The first is transient vasoconstriction. Appreciate the vasoconstriction. That second is vasodilatation, persistent vasodilatation, appreciate it. The third is increased hydrostatic pressure, so fluid leaks out leading to edema, the transudate edema. Then increased vascular permeability, the 4th step, the hallmark step. So gaps are created. From this gap, the protein also leak out and the edema, transudate edema converted to exudate edema. That is step number 4. And you know the 5 mechanism of increasing this permeability. And 5th step is slowing or stasis. So these are the 5 steps, among which the hallmark step is this one. The hallmark step is this one. Among total 11 steps, the hallmark step is this one. So these are the 5 vascular events. Now, what are the 6 cellular events? What are the 6 cellular events? First, there is margination. WBC leave the center and come at the periphery. That is axial blood flow convert to reverse axial blood flow. Then rolling. Then just before the gap, it's adhesion. Then transmigration or diapediasis. Then chemotaxis and then phagocytosis. And you know the 3 steps of the phagocytosis. So these are the 6 cellular events. So the 5 vascular and the 6 cellular. Total 11 events at the tip of your tongue. I will show you 2 videos. In one video, the 5 vascular events, and in one video, the 6 cellular events. The first 5 vascular events. Appreciate first microbe is coming. You can appreciate this is terrorist entered. The first step is transient vasoconstriction. Appreciate the vasoconstriction. Transient vasoconstriction. See. Vasoconstriction, it's happening. It is vasoconstriction. The second is persistent vasodilatation. See. It's persistent vasodilatation. Appreciate the vasodilatation. Then increase hydrostatic pressure. Appreciate the fluid leaks out. Outward pressure is more than inward. Appreciate the fluid leaks out. Outward is more than inward. The third step. Okay, the fourth step is increased vascular permeability, in which the gaps are created. Increased vascular permeability, the gaps are created. From this gap, the protein also leak out, so transurate convert into exudate. That is fourth step. Transurate convert into exudate. The fifth step is blood stasis. Now, fluid also leak out, protein also leak out, so the cells are accumulating. That is blood stasis. So these are the 5 steps. Now, coming on 6 cellular events. The 5 vascular events are done. Now, 6 cellular events in the next video. So first, WBC is at the center. From the center, it is coming to the periphery, that is margination. Then rolling. You know the 5 pairs of complementary adhesion molecules. Then adhesion. Then transmigration, then chemotaxis, and then phagocytosis. And you know the 3 steps of phagocytosis. So we are done with acute inflammation. If it is coming as a long question, you are ready with the 5 cardinal features, and you are ready with the 11 steps, the 5 vascular events and the 6 cellular events. It's a long question and you are ready for it. Okay, now the next is chronic inflammation. Chronic inflammation. Usually it is asked as a short question. It is also known as granulomatous inflammation. So what is chronic inflammation? If it is coming as a long or short question, you have to write under these headings. Okay, so under these headings, we will start. First of all, you tell me what is a granuloma, how it is formed, what is the definition, what is the structure. Okay, so what is granuloma? Granuloma is type 4 hypersensitivity. In acute inflammation, we are having 11 steps, but in chronic inflammation, we are having just 3 steps. It's very small and easy. Only 3 steps. Here, out of 11, the 5 are vascular, the 6 are cellular. Here, we are having only 3 steps. What are the 3 steps? I would like to draw it for you. What are the 3 steps? First of all, there is a antigen. There is an antigen. The antigen is non-degradable. The antigen is non-degradable. Like it can be Mycobacterium tuberculosis, Mycobacterium leprosy, talcum powder. They are non-degradable antigen. As soon as it enters in my body, suppose I'm inhaling this antigen, the first cell it will come in contact is antigen presenting cell. Antigen presenting cell engulfs this antigen. Okay, try to degrade it, but unable to degrade it because it is a non-degradable antigen. So since it is a non-degradable antigen, the antigen presenting cell will present this antigen. Antigen presenting cell will present this antigen to the next cell. The next cell here is helper Th1 cell. Helper Th1 cell. Okay, helper Th1 cell get stimulated and it will secrete 3 cytokines from it. What are the 3 cytokines it is secreting? Interferon gamma, interleukins, interleukin 1, 2, 11, many interleukins are secreted, and TNF alpha. So these are the 3 cytokines you have to learn, the 3 chemicals, the cytokines helper Th1 is secreting. What does these cytokines will do? They will take one cell out of the blood and make a granuloma. Which cell they will take out? First, let's talk about the interferon gamma. Interferon gamma will take the monocyte out. In the blood, we have monocyte. The monocyte will come out. The monocyte once out, this is known as macrophage. Once the monocyte out, it is known as macrophage. Okay, not only this, it will modify the macrophage by increasing its size, making the nucleus more vesicular. So it is known as modified macrophage. A modified macrophage is known as epithelioid cell. So basically, what is the epithelioid cell? Epithelioid cell is nothing, it's a modified macrophage. Not only this, it will fuse many epithelioid cell and make a giant cell. So all this activity is done by the interferon gamma. It is taking the monocyte out of the blood, making it macrophage, modifying macrophage and making epithelioid cell, and fusing the epithelioid cell and make the giant cell. So this is done by the interferon gamma. Now after that, what interleukin is doing? Interleukin just take the T lymphocytes out. It is doing the migration and proliferation of T lymphocytes. It is doing migration and proliferation of T cells, T lymphocyte. And what does TNF alpha is doing? TNF alpha is doing migration and proliferation of fibroblast. So how many cells we are having at the end of the day? We are having epithelioid cell, giant cell, T cell and fibroblast. So epithelioid cell and giant cell will make the center of the granuloma. T cell will make the middle zone of the granuloma, and fibroblast will make the outermost zone of the granuloma. And this is how a granuloma is formed. On the next page, I will draw a granuloma. At the center, I will draw these two, epithelioid and giant cell. In the middle, I will draw the T lymphocyte, and outer, I will draw the fibroblast. So at the center, we are having epithelioid cell, maximum epithelioid cell, and few of them are joint cell. This is center. The middle zone is having T lymphocyte. The middle zone is having T lymphocyte, and outermost is having fibroblast. Outermost zone is having fibroblast. This is a typical diagram of a granuloma. This is how it is formed. So in the center, the epithelioid cells and giant cells, this is epithelioid and giant cell, they are due to interferon gamma. The middle T lymphocyte, they are due to interleukins. And the outermost fibroblast, it is due to TNF. That's what you have to learn. The 3 cytokines which are making a typical granuloma. The end result of type 4 hypersensitivity is a granuloma. The end result of chronic inflammation is a granuloma. So this is the 3 steps of the chronic inflammation. I hope you got the 3 cytokines and the 3 steps. Only 3 steps. So first, there is an antigen. Antigen is non-degradable. It is engulfed by antigen-presenting cell. Macrophages are antigen-presenting cell. They are unable to degrade it, so they will stimulate the helper Th1. Helper Th1 secrete 3 cytokine and they will make a granuloma. And this is type 4 hypersensitivity. One by one you will see. This is the same diagram you can see. I will show you the steps also. You can see this is non-degradable antigen. Appreciate it. It is engulfed by APC. This yellow cell is APC. You can appreciate APC have engulfed the antigen, but you can see it is unable to degrade it. Since it is unable to degrade, it is giving a signal to helper Th1. Helper Th1 secreting 3 cytokine, interferon gamma, interleukin, and TNF. And they are taking some cells out and making a granuloma, the granuloma. So what are the 3 steps? First, there is the antigen, which is non-degradable. Write down the non-degradable antigen. It is engulfed by macrophages or APC. Meaning is same, APC or macrophage. It is unable to degrade it. Unable. It will try to degrade, but since antigen is non-degradable, it is unable to degrade. It failed to degrade. That's why it will present it to the helper Th1. The helper Th1, CD4 lymphocytes may be consa. To be specific, it is helper Th1. Helper Th1 get activated and it will secrete 3 cytokines, interferon gamma, interleukins, and TNF alpha. What does they do? The third step, interferon gamma take the monocyte out into macrophage, modify the macrophage into epithelioid cell and fuse them to form the giant cell. You can write down fuse them to form the giant cell. Interleukin 1 and 2 will do T cell proliferation and TNF alpha will do fibroblast proliferation. So how many cells we have? They will arrange and form a granuloma. You should be able to draw the diagram of a granuloma. What is a granuloma? It is a focus. It is a focus having 3 types of cells. The center is having epithelioid cell surrounded by giant cell. This is center. It is surrounded by T lymphocytes, few plasma cell, and outermost zone is fibroblast. So typically you should be able to draw it. Now how many type of giant cells are there? It is having giant cell. Now what is a giant cell? Giant cell is formed by the fusion of epithelioid cell. How many type of giant cells are there? There are 4 type of giant cells. It's a short question. There are 4 type of giant cells. Foreign body giant cell, Langhans giant cell, Totten, not Trotten. Totten giant cell, you can do correction. Totten giant cell and giant cells and tumor. So one by one we will see. You can see the foreign body giant cell. What is the difference? They all are formed by fusion of epithelioid cell except the tumor giant cells. Tumor giant cells are the tumor cells. They are not fusion of epithelioid cell. The remaining 3 are the fusion of the giant cell, fusion of the epithelioid cell. These 3 are the fusion of epithelioid cell. They all are multinucleated. They have multiple nucleus. In foreign body giant cell, the nucleus are haphazardly arranged. Appreciate the nucleus are haphazard anywhere. Okay, in Langhans, the nucleus at the peripheral 2/3. Either at the peripheral 2/3 like a horseshoe ring, or at the poles. This is Langhans. In the Totten, the nucleus is, multiple nucleus are arranging in the form of a ring. Arranged in the form of a ring, and the cytoplasm have the vacuoles. This is Totten. And these are tumor giant cells. These are the tumor cells. So foreign body giant cells may, the nucleus is scattered anywhere. Langhans giant cell may, either it is in the form of horseshoe, 2/3 ring, or it is at the 2 poles, North Pole, South Pole. And Totten giant cell may, the nucleus is forming a ring with vacuolated cytoplasm. So these are the 3 types or 4 types of the giant cell. How many types of granulomas we have? I told you typical granuloma. There are 2 types of granuloma. Listen. Can we draw the granuloma again? In the center, we are having epithelioid cells. In the center, we are having epithelioid cells and few giant cells. In the middle zone, we are having T lymphocytes. And in the outermost zone, we are having fibroblast. You can appreciate the fibroblast in the outermost zone. Now, this is a granuloma. It is known as non-caseating granuloma. Sometime at the center, there is caseous necrosis. At the center. This is known as caseating granuloma. So there are 2 types of granuloma, caseating granuloma and non-caseating granuloma. Caseating granuloma have necrosis at the center, caseous necrosis. And non-caseating granuloma have no necrosis at the center. You have to learn the examples for your MCQs. Caseating, TB comes in both, caseating as well as non-caseating. Along with TB, there is histoplasma, syphilis and coccidomycosis in caseating, sarcoid and Hodgkin's lymphoma in non-caseating. Learn the examples. Okay, 2 special granulomas you have to learn here. One is naked granuloma. Naked granuloma don't have T lymphocytes. It is having epithelioid cell and giant cell, but it is not surrounded by the middle zone. The middle zone is absent. The T lymphocytes are absent. It is known as naked. The T lymphocytes, it do not have the mononuclear cells, I mean T lymphocyte. The one is stellate granuloma. Stellate means star. Stellate means star-shaped granuloma. Typically, appreciate the star shape. Appreciate the star shape. It is typically seen in cat scratch disease and lymphogranuloma venerum. It's your MCQs. It is more important for your very short questions or your MCQs. So that is a type of granuloma. How many examples of chronic, I taught you the chronic inflammation, the 3 steps of the chronic inflammation. Okay. So how many examples you know of chronic inflammation? How many examples? There are 17 examples. Out of the 17 examples, 8 of them are bacterial. 8 of them are bacterial, 4 of them are fungal, 1 is parasitic, and 5 are miscellaneous. So 8 plus 4 plus 1 plus 5 you can do. So these are the examples. Please read it. It is given in your books. Please read these examples with their causative agent. These are the examples of granulomatous inflammation. It is asked in Vivas also. Say the examples of granulomatous inflammation. You say only TB, leprosy, but you should know the complete list. So if I'm an examiner, I'm asking you state the examples of chronic granulomatous inflammation. You should say it is bacterial, viral, parasitic, and miscellaneous. In the bacterial, you should enumerate the list. In the viral, you should enumerate the list. In the fungal, in the parasitic, likewise. So this is all about the chronic inflammation. It's in front of you. So if it is chronic inflammation coming in your exam as a long question or short question, you should be able to write down the 3 steps. You know the 3 steps of chronic inflammation. Type 4 hypersensitivity. First, engulfment of non-degradable antigen by APC. Then presenting it to helper Th1, and then the 3 cytokines making a granuloma. You should be able to say the definition of granuloma and structure of granuloma. You should know the 4 types of giant cell. You should know the 2 types of granuloma. What are the 4 types of giant cell? Foreign body giant cell, Langerhans giant cell, Totten giant cell, and giant cell in the tumor. What are the 2 types of granuloma? Caseous and non-caseous. And 2 special type is also there, stellate granuloma and naked granuloma. These are the special type if you are learning just for examples. And you should know the 17 examples of granulomatous inflammation: bacterial, fungal, parasitic, and miscellaneous. So I think you have sufficient material to write in your long question as well as short. If it is short question, they will ask one of them. You have to write that portion only. If it is long question, you have to write your answer under these heading. So that's all about chronic inflammation. So if acute inflammation is coming in your exam, write down the cardinal features and 11 steps. And if chronic inflammation is coming in your exam, write down the 3 steps with their well-labeled diagrams. In exam, you get marks because of the diagrams in your second Prof University exam. Please don't forget to draw whatever diagram I'm teaching you. You should be able to recreate it in your exam. So 11 steps of acute and 3 steps of chronic should be at the tip of your tongue. The last thing is chemical mediators of inflammation. Usually it is asked as a short question. You should know how it is listed. The chemical mediators of inflammation. So there are 2 types of chemical mediators of inflammation: cellular and plasma. Cellular, they are the present within the cell and they are secreted out. And plasma, they are synthesized in the liver and they come in the plasma. You can see you have to just learn the list. Just learn the list. Cellular, we again divide into 2 categories: preformed and newly synthesized at the time of inflammation. These are preformed. They are always present inside the cells. And these are newly synthesized at the time of inflammation only. So 4 are new formed and 4 are preformed. The 4 preformed is histamine, serotonin, lysosomal enzymes, and neuropeptides. The 4 newly synthesized is nitric oxide, arachidonic acid derivatives, platelet activating factor, and cytokines. And the plasma derived is kinin system and complement system. Okay, so that's all. Here in rapid revision, you should know their classification only. If you want the detail, it is given in my elaborative book, but usually it is not asked. You should learn the classification at least for your university exam. That's all about inflammation. So you are prepared for your long question on acute, long question on chronic, and short question on overall inflammation and chemical mediators. Short question on them. You are prepared. Okay. And usually one of the question on long question on acute or chronic, very frequently asked in your university exam. Now, what all university exam question asked from these topic in your university exam? So see, the long question, short question, very short question, and MCQs. In your university, few MCQs also come. I guess in some universities, 14 MCQ, in some university, 20 MCQ come in their exam. So this is the long question list. We have gathered the question list from throughout Pan-India University. This is the short question list. Appreciate the short question. This is very short question. Okay. So it is already given on the app. Please go on the app. It is given university wise also, topic wise also. So currently I taught you inflammation. Go in the topic inflammation and see all long question, short question, very short, and MCQ. It's your choice. If you want to go university wise, we have covered 30 major university pan India. Search your university may be there. So university wise also past 5 year PYQs, long question, short question, very short question, already uploaded on app. I request all of you to have a look on that and see whether you are prepared for them or not. Thank you so much.